Good morning. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you have joined us today for the Psychiatric Education Capacity Expansion, or PEACE, Psychiatry Residency Program Informational Webinar. Before we begin, I'd like to discuss a few housekeeping items. Number one, our webinar is hosted on Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Number two, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. And number three, today the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. Due to an issue with the Microsoft Teams platform, we ask that you do not use the Q&A feature and instead use the chat function to ask your questions. Thank you for your understanding and cooperation. Here's today's agenda. As you can see, after we're done here with the introduction, we will have some opening remarks from Grants Section Chief Wahida Nawab, followed by an explanation of the PEACE program by Program Officer Mohammed Arshadi, and then we will open her up for Q&A at the end. And with that, I am thrilled to introduce Wahida Nawab, Grants Section Chief.
Thank you, Chris. Hi, welcome everyone to our webinar here, virtual webinar. Today I will be going over a few of the background admissions, and I am one of the section chiefs here at HCAI for the Office of OHWD. So the background admission, the Department of Healthcare Access and Information administers health workforce programs, including the Psychiatric Education Capacity Expansion, PEACE grant programs. State budget appropriation funds the expansion of post-secondary education and training to meet behavioral health, occupational, and service shortage needs. This grant opportunity will result in one or more grant agreements with educational institution, medical sites, or other organizations to develop and expand psychiatry residency programs that train and prepare residents, child and adolescent psychiatry fellows, and or addiction psychiatry fellows to serve underserved children, youth through age 25 and their families, as well as other at risk of chronic behavioral health conditions. HCAI expands equitable access to quality, affordable health care for all Californians through resilient facilities, actionable information, and healthcare workforce each community needs. Next slide. Health workforce development supports and increases a health workforce that serves medically underserved areas, represents the California it serves through racial and language diversity, serves medical members, offers programs that provide financial support for organizations expanding educational capacity, individuals to pursue health careers, scholarships and loan repayments, organizations to build the workforce pipeline. The Psychiatric Education Capacity Expansion, PEACE Psychiatry Residency Program overview. The program purpose is to increase the supply of psychiatrists working in California. Program goals: increase the number of underrepresented individuals in health professions training and practice, support cultural and linguistic diversity, create more equitable workforce geographic distribution. This description of the services, this grant opportunity will fund organizations to develop and expand psychiatry residency program that train and prepare the following three: psychiatry residents, child and adolescent psychiatry fellows, addiction psychiatry fellows. Next slide. PEACE guiding principles: to provide care that is client-centered for adults with or at risk of serious mental illness, with priority on early intervention. Provide care that is child and youth-centered with priority on early intervention. Ensure racial diversity, cultural humility, and linguistically competent workforce. Conduct outreach to and engagement with unserved and underserved and inappropriately served. Use effective and innovative evidence-based and community-identified practices. Next slide. Promote wellness, recovery, resilience, and other positive behavioral and primary healthcare outcomes of children and youth and their families. Include the viewpoints and expertise of persons with lived experiences. Work collaboratively to deliver individualized, strength-based, consumer and family-driven services. Promote interprofessional care by working across disciplines. HCAI expects these guiding principles to be used by grantees to inform their educational materials and training. Next slide. And now I will be introducing you to one of our analysts. His name is Mohammed Ashadi. He's one of the program officers, and he will go into details of the program. Thank you.
Thank you, Wahida, for that wonderful introduction. Ladies and gentlemen, good morning. My name is Mohammed. Apologize, sorry. Looks like I was getting the call in the middle there. And then I'm going to go over some important details about the program and some key dates. So the application is already available, which became available on the 23rd of February at 3 p.m. And it will go on till April 8th. As you can see, the submission deadline is April 8th. And then this webinar, which is today, and then anticipated award notices will be released on June 30th, 2024. And then scholarship, well, not scholarship, but grant agreement start date will be July 1st, 2024. Thank you. Next slide, please. So regarding the funding, the new program's funding to obtain accreditation by the Accreditation Council for Graduate Medical Education, ACGME. And then the program expansion is first year of activity focused on obtaining ACGME permanent approval of additional slots. So that's for expansion programs. You're adding more slots, developing the expanded program and recruiting faculty, rotation sites, and residents. Thank you. Next slide, please. Psychiatric residency grant program elements. This is for the new program. If you're applying for a new program, I mean, the period for grantees to secure accreditation council for graduate medical education, ACGME accreditation is 3 years. Funding is for grantees to obtain ACGME by June 30th, 2027. And then HCAI will release grant funds in 3 payments. The first payment, so this will all be outlined, by the way, and on our grant guide. So if you forget any of this information, that's okay. We'll have a link provided for the grant guide, and you don't have to remember all this. But HCAI will release grant funds in 3 payments, 25% upon providing request letter to ACGME or ACGME granting institutional accreditation. And then the second payment will be 25% upon completion of select phases of work. And then, as we mentioned here, you will see the grant guide for that, because that is in a format that is really detailed, and you will find that in the grant guide. And if you have questions regarding that, we can answer those. And then the third payment will be balance of funds for allowable expenses when HCAI receives proof of all required work up to the grant amount awarded. Thank you. Next slide, please. So similar to new program, then we have the elements for the people who are applying for expansion. So the grant period for psychiatry residency program expansion is 5 years. The first year of the grant may be dedicated to developing program expansion, hiring faculty, securing additional rotation sites, and recruiting new psychiatry residents. Then funds will be paid annually for expenses incurred. So I just want to open up a parenthesis here. So we usually will have you guys submit annual reports for those 5 years. And then those are usually, and we'll get to that in the future slides too, but they'll be usually due at the end of the fiscal year, which is in July. So those will be due in July. And then based on those, we will hand out the payments. And then the last point is ACGME approval is required before any funds are released. Thank you. Next slide, please. And then for the psychiatry residency grant program for the award section, and non-supplementation grants must be used to supplement existing funds and not to replace funds the grantee has received from another source for the same purpose. And then administrative indirect costs. So grant funds cannot be used for administrative or indirect costs. These costs are built into the grant award, so we don't have a separate payment for that. And then award levels. HCAI may award full, partial, or no funding to an applicant based on the applicant's evaluation score and the amount of available funds. Next slide, please. Then geographic distribution. Award decisions will depend on application scoring results and geographic coverage across California. Applicants will be awarded no more than their total cost of attendance for 1 year of the program. And within 6 months of graduation, awardees must begin 1 year service obligation providing direct client-patient care in a qualified work site. Thank you. Next slide, please. And I do apologize. Sorry, I know my lighting is not really good here. I tried my best. Psychiatry residency grant application process. So at this point, we get more into the how the application process is. So we have different steps for those. I want to emphasize before we move to the next slide that we do have a technical assistance guide that we have been working on really hard, so to make it basically seamless for people who apply. So we will post a link for that, and then I highly encourage everyone to, like, if they're submitting an application, to have that side by side so they can basically see what step they are on, and they can fulfill those steps based on the technical assistance guide. Next slide, please. All right, so those components you're going to see in the application are these 10 components we're reviewing here right now, and step by step. And these are basically what we have in the technical assistance guide. So the first one is general information. So that would be your institution's general information and your profile information. I think everyone is familiar with that sort of thing. Program information, you explain basically things about your program, and then contract administration. Then you have your program data. The next things you see here are included in the program data based on the route you choose to take, whether it's a new program or expansion program. So you have rotation sites, faculty qualifications. These most likely will be in multiple choice options you can select from. And then budget funding will be the next section. And then you would have recruitment and other strategies. Those are also in the multiple choice options that you can select from the strategies you plan to implement. And then the last section will be the required documents. So based on the route, again, you take, you'll be asked to upload required documents for the program or for the grant program in PDF format. And then there is one last step which will ask you, it's the page for assurance, and that will ask you if you feel comfortable with your application before you submit it. Thank you. Next slide, please. And then these are the grant application requirements. You will submit a letter of sustainability committing the sponsoring organization to support new or additional training slots when HCAI grant ends. And you will list current and or proposed placement sites or field placement rotation sites. And then you will have your budget section for the proposed expenses, ACGME accreditation letter, and this is for expansion programs. List of personnel in charge of training staff, that is also for expansion programs. And then required documents, as I mentioned, that would vary based on the pathway you select or what type of application you're applying for. Thank you. Next slide, please. So the grant application budget section for the new psychiatry residency programs, eligible programs may receive an award up to $2,500,000. And for the expansion of existing psychiatry residency programs, eligible programs may receive $175,000 per filled first-year new positions or slots. Thank you. Next slide, please. So these are some of the payment provisions. HCAI expects the grantee will begin performance of the grant agreement on the start date listed on the grant award documents. The state controller's office will mail you a paper check, so that's a different department from ours. They will handle your payments. to the grantee's address on file. And then please ensure you have, and I can't stress this enough, to make sure you have your address match your IRS records, because in order to prevent any delay in payment, so make sure those all are squared away. HCAI cannot provide tax advice to grantees. HCAI staff are not tax professionals, and tax consequences may vary depending on the grantee. For this reason, that's why we ask everyone to have a professional for any tax advice they might have, because we surely cannot provide that to you guys. But HCAI reserves the right to recover monies for grantees' failure to perform services and other grant agreement obligations. Now, that technically is saying that if you have the things that conflict with your grant agreement, then we're reserved the right to take any part of the fund or any of the money back. Thank you. Next slide, please. Evaluation criteria. Evaluation criteria include the following themes, and for a detailed list of this, we have attachment tables within the grant guide. You can also follow those, and we will also have the questions open at the end of this presentation if you have any questions regarding these matters. But percent of patients served who primarily speak Medi-Cal threshold languages is one of the criteria. Residents recruitment strategies, workforce and areas of unmet need strategies, cultural competency strategies, payer mix, Medi-Cal, which includes Medi-Cal, Cal Medicare, and uninsured payers, HPSA mental health score based on location of rotation sites, and then also HCAI also intends to support a geographic distribution across California. Next slide, please. This part is for the scoring part for the expansion programs or those who are applying to expand their programs. Evaluation criteria include the following themes: provide payer mix information in terms of percent for 12 months for the calendar year of 2023, and then mental health HPSA severity. That is explained also in detail what we mean by that in the grant guide. Do you include facilities in rural areas? Also provide the number of patients served at rotation sites in previous years. Provide the percent of listed Medi-Cal threshold languages and indigenous tribal and sign languages spoken by current psychiatry residency program students. And then what strategies you will use to recruit and support psychiatry residents from underrepresented communities. Again, what strategies you will use to encourage your psychiatry residents to practice in areas of unmet need. And then what strategies you will incorporate to implement culturally responsive care training into the program's curriculum. Thank you. Next slide, please. Now for the new program scoring, the criteria, some of the criteria are similar and some are different. Evaluation criteria include the following themes: how many first-year residents will you add to the program? Do you include facilities in rural areas, similar to expansion program? What strategies you will use to recruit and support psychiatry residents from underrepresented communities? And then also what strategies you will use to encourage your psychiatry residents to practice in areas of unmet need? And what strategies you will incorporate to implement culturally responsive care training into the program's curriculum. Thank you. Next slide, please. Annual program reports, and this is kind of what I was referring to about a couple of slides back regarding you having to provide us annual reports by the end of the fiscal year. Report on student outcomes. These reports will include program reports required to receive payments. As mentioned before, reports are due in July 31st of each grant year. So that's technically the month after the fiscal year ends. Grantees will report on the numbers of applicants and admitted residents and those interested in serving underserved communities. A use of peace guiding principles and training materials and training. How HCAI funds support specific residents or are used for the entire cohort's training. Thank you. Next slide, please. So these are some of the resources that you can use that I was mentioning throughout the presentation. The grant guide is probably your best go-to resource because it will explain the program. It will have the key dates in there. It would also have the scoring and evaluation criteria in there. We have attachments even for how the grant agreements will look like and things you can focus your attention on. And then the second link provided here that you see on the slides is for the technical assistance guide. That is a complete guide for you to fill out an application. So it's a single application. So once you are on that, if you're expansion or a new program, you won't see that immediately. But as you progress through the application, it will branch out and you can select from which one you're applying for. And the TA guide will assist you step by step. We have both psychiatry residency expansion and new program applications within the TA guide. And then the last link you see here is the online application itself. Highly recommended to review the grant guide and the technical assistance guide before you start that link, because there is some steps that you have to follow, such as making a profile or an account before you start the online application. And then the last point is what I just pointed out, is if you're seeking support for both psychiatry residents and child and adolescent fellows, you will use a single application. Next slide, please. All right, and just to basically repeat the application timeline, it is already open. It has opened since February 23rd, 2024, and it will close this coming April on the 8th. And then for more information, please do visit our behavioral health program. The link that is associated with that is the page that will have the grant guide and the technical assistant guide links also on there. And as Chris has kindly mentioned, these slides will be uploaded within 7 to 10 days anyway, so you will have access to all these links. And then finally, if you are not sure what program to apply for, we have the HCAI's funding eligibility tool. Let's say you have listened to the entire presentation, but you can't still figure out if this is the right program for you. I would advise to use that tool. This tool will help you go through some questions, and it will help you understand if you should apply for this program, if this is the right program for your institution, or if you're individual. It will direct you to other scholarship, grant, or loan programs that HCAI supports. Thank you. Next slide. And at the end, I just wanted to thank you all for tuning in today. Sorry if I went kind of fast. I appreciate your patience with me. And with that said, I'm going to hand it off to Chris if you have any questions.
All right. Thank you so much, Mohammed. As you can see, our team has put a lot of work into this program, and we're excited that you've joined us today to learn more. We are going to transition into our question and answer session, and the chat option is now accessible in the menu bar at the top of your screen. Again, due to an issue with the Microsoft Teams platform, we do ask that you do not use the Q&A feature. Instead, please use the chat function to ask your questions. We will answer questions in the order that they are received, and we'll do our best to answer all the questions that you have today. And the chat is open, so go ahead and start asking those questions, and we'll start answering. All right, give people a second to.
Chris?
And did you want to do the slide correction? We want to go back to slide.
I just want to clarify for prospective applicants that for the expansion program, that the funding for each new resident, total funding is $700,000. The $175,000 has to do with each year. So I just wanted to clarify that point.
Yeah, thank you for that, Ann.
Thank you, Ann. All right, our first question comes from Matt. Is the new funding track strictly for accreditation?
I'm sorry, Chris, repeat that again?
Yeah. Is the new funding track strictly for accreditation?
It's for seeking accreditation, I believe, but if I'm
Yes.
incorrect.
That's correct.
All right, thank you. Ashley asks, if we already have applied for ACGME accreditation but are still pending approval, do we qualify for new program funding?
I'll answer
And-
that. It
Go.
depends on what phase you are in the process. So you will look at the application. It will tell you if you are still in the middle of your accreditation process, you may be eligible, but look at the application to make that determination. It's complicated. There are 7 different phases that you have to be eligible for funding at some phase.
Thank you, Anne. All right, next question. We are a new psychiatry residency program slated to start on July 1st, 2024. We've already received ACGME initial accreditation. Would we be eligible to apply as a new program since we don't have residents yet?
Though I don't believe that funds are intended for that purpose, but if somebody wants to correct me, that's fine. But because specifically because scholarships was mentioned, I'm saying that.
So to clarify, the money is only if you're in the process of obtaining your accreditation. If you already have accreditation, you may be eligible for expansion, and that is something you should look at considering.
All right, thank you, Anne. Next question from Anna. Good morning. We are starting a new residency at Kaiser. We want to recruit underrepresented medical students going into psychiatry following the UC Davis ACE primary care model. May we use the funds for scholarships for the students so they complete medical school without any debt?
I believe, I believe that's the question that Anne just answered. I think it's because it's intended for starting a new program.
That's correct. And the money is intended to offset your costs of residency. It's not intended to support residents.
Yes.
All right, thank you. Next question, with already established programs, do you need a letter from both the institutional GME and the ACGME organizations?
For an existing program, we need a copy of your current ACGME letter that shows you are accredited. The institutional accreditation letter is necessary for new programs whose programs have not been fully accredited.
Thank you. And next question. If we completed the process and received accreditation from 2022, but have not yet had a student cohort, would we be eligible as a new program, or should we apply as an expansion of an existing program?
You would not be eligible for a new program because you are approaching or have completed your accreditation process, but you may be eligible for expansion, and that is something you may consider.
All right. And give people a chance to ask any more questions that they have. Here we go. Let's see. For clarification, we can use the funding for medical students and not just residents.
I believe that would be correct, yeah.
All right, thank you. And the next question, those residents who are part of this program, do they need to work in an underserved area upon graduation? And if so, for how many years?
Oh, okay, so for that, I believe that's a evaluation criteria that we have. I don't think it necessarily disqualifies them, but Anne can clarify if I'm incorrect, but that's one of the things that I think they're scored on, the application is scored on, but it's not a like a solid in stone requirement.
All right. And really good question so far. And we've got plenty of time in the webinar still. Next question, for a new program, can funds be used for building out the clinic location where the residents will be?
Yeah, that I want to be sure that I answer. If Clinton or Ann wants to jump in to cover that question, I am not 100% sure.
It is the policy that we are supporting programs, not construction.
Right. We really do appreciate everyone taking the opportunity to ask these questions. It's helpful for us to continue to improve these programs as we work to serve everybody best on this. All right, next question. Would you mind giving some examples of what would be acceptable use of funds? Just hoping for more details about what supporting the program costs would be.
The grant application lays those out. It is the cost of rotations in existing sites, as well as faculty and other related, primarily staff and faculty support.
All right, thank you, Anne. Yeah, let's see here. We're working on getting some links posted in the chat as well, so you can take a look at the resources if you haven't seen them yet. Reminder, you can go to our website to find all of those resources as well. We'll have that link in the chat here momentarily. And also, if you do find that your questions after this website or webinar is done, we will have an email address at the end that you can ask questions as well. Next question, can you please expand on, can you please expand on the faculty support? Is it teaching and or supervision time?
It would be both.
All right, thank you, Anne. Thank you, Mohammed, for posting the link. You guys can visit our webpage there and find all of these resources. Stephanie asks, can funds be used to support resident salaries or stipends for conferences and resident learning?
So I believe that would be detailed in the yearly reports that you guys send us. So I believe that's part of one of the categories that you can bill us for, if Anne wants to complete that thought, but yeah, I believe they can.
Thank you, Mo. Next question. Apologies for asking this question in multiple ways, but want to clarify that the funds can be used for scholarship support for medical students going into psychiatry.
Sorry, not sure exactly if I'm understanding the question, but yeah, for psychiatry residency, yes.
Clarification that the funds can be used for scholarship support for medical students.
I believe that is correct, yeah.
All right. All right, Alicia, thank you for that question. All right. And as I mentioned earlier, if you get to the point where the webinar is over and you think of your question, you will be able to email us at bhprograms@hci.ca.gov to ask any further questions. Give people another minute or so here to think of any other questions that you might have.
Yeah, thank you, Chris. Yeah, as Chris mentioned, like if you guys have questions that might not come to mind right now, you can always email us at bhprograms, B as in boy, H as in Henry, programs, plural, at hci.ca.gov. And then we will we will appreciate your questions and we will answer them in a timely fashion.
And Mohammed, I do see a clarification in our chat to one of the answers if you want to address.
Yeah, so I just wanted to be as specific because it was brought to my attention. The funds have to be psychiatry residency related expenses. So medical students who are not residents wouldn't be allowed for this program.
So I believe, Alicia, that is back to your question, clarifying the answer on that one. Okay, Anna says, I've had some trouble getting a reply to my emails and calls. Any direct lines we can use? The BH programs at hci.ca.gov, we are monitoring that, and I apologize if we haven't gotten back to you. We'll make sure that we look at that. And team, if we can make sure we're looking out for Anna Vintner's emails, make sure we can get to her. All right, next question. Should we reach out to the email address to review where we are in the ACGME application process and what we may or may not qualify for in regards to new program versus expansion program?
Yeah, I think for the review of your ACGME accreditation, if that was the question, no, we can't check on the status on that. I believe they do have a website for that you should be able to follow up for the status. I didn't understand the second part of the question, sorry.
They're asking, Mohammed, they're asking if they're trying to figure out, they know where they are in the process, but they don't know what they qualify for. So they're wanting help on guiding, here's where we are, what do we qualify for? Trying to understand if they're going to be a new program or an expansion program based on where they're at in the process.
So if you refer to pages 8 and 9 in the Psychiatry Residency Grant Guide, you will see grantee requirements and accreditation phases. Payments will be tied to where you are, or the amount of the grant would be tied to where you are in your progress to the in the grant. The actual payment provisions themselves appear on page 10.
Perfect. Thank you, Anne, for that clarification and guidance.
Yeah, I'm also going to try to include the link for the link that helped with people with which program they should select, because I believe some of these questions can also be answered through that. But give me one moment here and I will go ahead and do that.
All right. And Ashley, if you do go through all of the resources and you still have questions, yes, please do reach out to the BH programs email, and our team will be happy to help you. And thank you, Anne. There's the link directly to the grant guide if you haven't seen it yet. That will have answers to most of the questions that you have. Yeah, give another minute or so if anybody has any more questions. All right, next question. If we want to expand both the adult and child programs, do they need to be on one application or separate ones?
Okay, so the application will be one, so there will be provided one link for submitting an application, then we'll branch off. So the way it branches off, and you will see this again in the TA guide when you're going through it, the first page will ask you what program you're applying for. So it would either be psych residency new program, or will be psych residency expansion program. And then we have completely different ones for psychiatric mental health and nurse practitioner programs too. But you would select those multiple choices, and then that's how you go. That's how your application will branch off from the rest of the program, and then you will continue your application that way. I hope that answers the question, but If it doesn't, please clarify.
So the expansion application is a single application that applies to both adult and child programs. So you would just do a single application.
All right, here. One more second here before we move on to closing thoughts. Give everybody a chance to make sure they get their questions answered, and then we'll. All right. Looks like we got through the questions so far. Again, if you do have a question, we are here to answer them. Thank you all for your participation in the Q&A session. Again, those are great questions, and they really do help us make sure that we're getting the right resources to everyone. If you do have more questions, again, please email the BH programs at hci.ca.gov. As a reminder, we will be posting the recording of this webinar and the slide deck on the website. Those should be up in approximately 7 to 10 business days. And now Wahida will provide some closing remarks.
Thank you, Chris. I just wanted to take a moment and thank everyone that has attended our webinar, and thank you to the HCAI team that organized this webinar and those of you that actually came on to support some of the answers for these very important questions, and taking the time to be here today and while we go over this program. So next slide. We would like for you all to follow us on our website, Facebook, LinkedIn, Twitter, and YouTube. You could hashtag, here are some hashtags that we've provided, and get us recognized out there. And we would appreciate that. The next slide will also discuss having you all sign up for our newsletter at hci.ca.gov/mail-list/. And you are welcome to contact us on the phone number provided here, 916-326-3600. And when you do leave a voice message, in case you're not able to get a hold of somebody, if you could please leave a clear pronunciation of your first and last name, which program you're inquiring about, and contact phone number or email address, that would be wonderful. And the email is bhprograms@hci.ca.gov. And thank you so much. You could go to the next slide, Chris. Thank you all again so much for attending our webinar. And if you have any further questions, please do feel free to email us, and we will get to your emails as soon as we can. And I almost said the correct number for our phone number is 916-326-3700. And we will update that on the slide when we do provide it, okay? Thank you.
All right, well, thank you so much for attending today. And with that, we conclude today's webinar. Have a wonderful day.